Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Thanks for having me.
Of course, my name is Dilshad Burman. I am a writer and reporter with CityNews and I will be moderating this chat today. How it works is we've been collecting your questions all week and we're going to be presenting them to the doctor for the first time. She's never seen them before. She doesn't know what's coming at her. She's going to answer everything as best as she can. If you haven't had a chance to submit your questions, you can still do so under this live broadcast and we will try to get to as many as we possibly can. Last week we had a flood of live questions. We tried to get to as many as we could. If we didn't get to them last week, we've carried them over to this week, so stay tuned to get to your question. For now, we're going to start with the submitted questions that we have. So, Doctor, are you ready to go?
Yeah, let's go.
Let's get started. We're going to start with a question about vaccines. We've got tons of them coming in all the time, considering that vaccines are top of mind for so many people. So let's start with this one. This one is from an anonymous submitter. They ask, now that AstraZeneca has been approved and studies show it is not as effective for those above 65, will Ontario change its rollout? As in right now, it's being rolled out by 80 and 85 and above are getting it right now. But because the AstraZeneca vaccine is not okay for people above 65, will they start vaccinating people who are younger?
Yeah, so we're going to have to wait and see what comes out from the province in terms of the recommendations for this vaccine. The National Advisory Committee on Immunization released their recommendations and said that this vaccine should be given to adults 18 to 64 years of age. It has been licensed to 18 plus, so we'll have to wait and see how Ontario decides to use the vaccine. Just because it's less effective, though, doesn't mean that there isn't a role for it. During the pandemic.
Right, absolutely. And I think we've seen this coming out a lot. Whatever vaccine you get, if you want to take it, right? It doesn't matter at this point what the vaccine is.
Yeah, and what we know is that the vaccines can prevent the severe illness, and that's really important as well. That's one of the reasons why part of lockdowns are because we want to preserve our healthcare system, and so that's a really important feature of the vaccine.
Right, absolutely. And then Wings is a regular contributor to our Q&As. They ask, what happens to vaccinated people when they do get COVID-19 in terms of severity or recovery time?
So what we know is that if you're vaccinated, it will prevent you from getting sick, from getting very sick, from even dying from COVID. And so it could be that you might get a COVID infection, maybe a milder infection, maybe an asymptomatic infection, but less likely to get those severe infections, very less likely to get very sick from a COVID infection if you're vaccinated.
Okay, and then we have some live questions coming in right now, actually. So let's go to those. Aurora asks, how safe is the Pfizer vaccine for seniors?
It's very safe. Actually, and it works in seniors. That's the other thing. So we know actually that all of the vaccines for COVID are very safe. There's actually just a very small group of people that can't get it, and that's if they have very severe allergies. Really, it boils down to polyethylene glycol. That's really the big one, and very few people are allergic to that.
Right. And then Dizzy asks, what are the long-term effects of the vaccines?
Well, we hope the long-term effects of the vaccine will be that you stay protected for a long time. If you're referring to any long-term side effects from the vaccine, there haven't been any reported. We actually have data now that's been presented from other parts of the world. In the U.S., so the CDC has reported on the side effects that they found related to the vaccine, and they are still, the severe side effects are still very, very small. The anaphylaxis that's occurred, those severe allergic reactions, within what you would expect for vaccines, and so on track to continue to be a very safe vaccine.
Okay, and then we'll go back to our submitted questions. Actually, we have one from our reporter, Maliha. Maliha asks, York and Peel region have launched their online sites to get seniors vaccinated, and people have been complaining about the wait time, seniors standing outside, exposed in the cold, that kind of thing. So when it comes to Toronto, do we have any idea what the rollout is going to look like for seniors? How soon will it happen? What is the process?
Yeah, so a lot of the rollout is going to depend on two things right now. One is vaccine, and that's across the board. And the other is the provincial online booking system is supposed to come on board mid-March. And so that's one piece that we're waiting on. In Toronto, it's not actually just public health who will be vaccinating. All of the hospitals will play a role. Community health centers will play a role. And so, so some of those places may have their own booking systems as well too.
Right, and Toronto isn't setting up its own booking system, correct? It's using the province's booking system.
That's right. So that's part of the wait for the Toronto Public Health clinics, exactly.
Right, okay. And then actually we have a couple more live questions coming in now. Let's go with Debbie. Debbie Smith asks, is any one vaccine better than the other?
I would say no. I would say right now, if you have a choice to get vaccinated, get vaccinated. The Pfizer and Mrna are very equivalent vaccines. Some people have asked, do I have a choice between those two? And I would say there's really not much difference between them. The AstraZeneca is a different type of vaccine. But again, in this place where we're during a pandemic, we're in vaccine shortages, really, if you're offered a vaccine, it's a safe vaccine. As long as you're able to get it, I would recommend that you get it.
Right, absolutely. And then Esteban asks, could I still become a long hauler even after being vaccinated?
You know, it's a good question. We don't quite know. I think it's definitely less likely because if you're not likely to get COVID infection, then you're not likely to become a long hauler. But that's, again, something that we're going to have to keep an eye on and keep studying.
Right, absolutely. Let's go back to the submitted questions that we have now. This is good. Again, this is we've got a lot of rollout questions actually now, especially when it comes to seniors. So KW asks, once seniors can start booking, will they get vaccinated at a mass vaccination clinic, or are there going to be locations closer to their homes?
There's going to be, so first of all, the mass vaccination clinics in the city are actually throughout the city. They're not just downtown, they're actually in all parts of the city. So that's one thing. If you're wondering, on our website, we have a list of them. But they will also be offered at other sites like community health centers, like at hospitals. Some pharmacies will have it. What we're not sure on is when will they have it, who will they vaccinate, and those details will come. But yeah, the vaccine is going to be available in all parts of the city.
Okay. And then again, just because we've got so many of these rollout questions, I'm going to sort of combine them a little bit. We've got questions from Sarah, Bernard, Marge, Natalia. Most of them are asking, when will their elderly parents get vaccinated, 80 plus or 60 plus. Some have comorbidities, some have high-risk chronic conditions. And because they live with their parents, will they be considered for the vaccine as well?
Yeah, these are all really good questions. We know right now, you know, next up from a community perspective, right now people are still getting vaccinated. It's a lot of healthcare workers, very high risk healthcare workers that are getting it, some frontline first responders, people who live in homeless shelters or are homeless are getting it. So people are getting the vaccine. It's based on prioritization. 80 plus will be the next community group to get it. And it stops there. It's not their people who live with them for right now. It's also not younger than 80 either for right now, but more to come on that. Once we have more vaccine available, the groups that will be eligible for vaccine will expand more quickly.
Right. And Dr. Actually, you mentioned the homeless population is getting vaccinated, and we have a related question there. Why are we vaccinating the homeless who might be younger than 80 when, you know, a person that is 80 plus is more likely to die from COVID? That was a question that came in our submitted questions as well.
Yeah, so you can be vulnerable for COVID for a lot of different ways. We've seen COVID actually spread in some of our shelter system, especially with the variants of concern. COVID has certainly impacted certain groups more. So age is one group. Living in a shelter or what we call a congregate setting can put you at higher risk for catching COVID. So that's one of the reasons why they're being offered the vaccine. And 80 plus will be offered the vaccine as well too.
Right. Okay. And then let's go on to some more questions here. Rick asks, I am 75. What happens if I don't want the AstraZeneca vaccine?
Right. So we're going to have to wait and see what the province recommends for that vaccine, who will be recommended to get the vaccine. So I can't quite answer your question. I don't even know if it's going to be offered to you at 75. So we'll hold that one and bring it back another week when we have more information.
Absolutely. And so actually, let's go to a live question then. Soumya Jacob asks, if I get vaccinated now and in the future there is a better vaccine that is 100% effective, what choice will I have? Can I take that future vaccine that is more effective again?
Oh, it's hard to talk in the theoreticals. Right now, there is no 100% effective vaccine. Actually, those vaccines are hard to find in general. I think a vaccine that's 94, 95% efficacy actually is really, really good. We're going to have to wait and see what the recommendations are going to be. In some countries, like in the UK, they're using mixed models with AstraZeneca and messenger RNA. Let's see what the studies show about that. So we don't quite have the information to guide that. I think what I can say to you very clearly is we will follow the science. It'll be based on what the science says, what is effective, what is COVID spreading, are the variants spreading, what is needed to protect us, and the recommendations will change. And the reason why they'll change is because the circumstance changes and we will adapt it to make sure that it's right for the circumstance.
Right, absolutely. This is interesting, and we've talked about mRNA vaccines a lot, but let's ask this anyway. This one is from Twitter, @Better asks, why is the mRNA vaccine considered a breakthrough? And is it a once in a lifetime vaccine, or does it need repetition?
So it's considered a breakthrough because we haven't had a vaccine that's used this technology before, messenger RNA. Now, the messenger RNA technology has been around for a decade or more. So it's not new technology, which is why we were able to use it quite quickly through COVID. But it's the first time a vaccine has used this technology. So that's why it's considered revolutionary from that perspective. And I think are you going to need booster doses? Is it one-time dose? We'll have to wait and see how well it performs 1 year, 2 years, 3 years, 5 years from now to see whether we're going to need to get another dose of it.
Right. So, Doctor, actually coming to that question, then, are we tracking people that have taken the vaccine for further study? Will that be something that we'll see maybe 1 or 2 years down the line, that people who got the vaccine this year will be studied later to check if they still have antibodies?
So as far as I'm aware, those people who were a part of the original studies are being followed. So they're being followed to check their antibody level so that we can have information. And that's quite common in vaccine trials, that you continue to follow the same group that started with the vaccine to follow their antibody levels to see whether they got sick, that kind of thing. We'll also have a sense from a population perspective as well, too. If most people got the vaccine and COVID doesn't come back, well, that's a good sign as well.
Yes, absolutely. Okay. This is interesting, again, because people are worried about variants. Kevin asks, how can vaccines made from the old strains of COVID be effective on continuously changing strains?
So the vaccine doesn't actually have any of the strains in the vaccine. The messenger RNA vaccines have the code for the spike protein. And so while the virus can actually change, the question is, how much is that spike protein, that's the protein on the outside of the virus, how much does that change? If that changes dramatically, we will have to update our vaccines. If it just changes a bit, then the vaccine that's been made will still provide protection.
Right. So here's a question from Anonymous then, more about variants. If you have had COVID, can you be infected with a different variant? And is there a possibility that the vaccines may not be as effective on the variant? How are they going to deal with that? Are they making different vaccines? Are they changing the current ones?
Yeah, so if you've had COVID, yes, you can get COVID again. You could get a different strain of COVID. So that is a possibility. And so the variant strains, it seems that the vaccines are actually effective. There's big studies that have been done in the UK and in Israel. And as I understand, it's the UK variant that is spreading there, and the vaccine still provided protection using the vaccines that have been available there. Now, will it work against all variant strains? What about new variant strains? I mean, it's a constantly evolving and something to watch for, but there certainly is evidence that for some of the variants that are out there, the vaccine will still provide protection.
Okay, that's good to hear. That's very heartening. Okay, let's do this one. Anonymous again, what happens if the vaccines that are available do not protect against the variants, and it's found that, say, you can't actually even take the vaccine? What happens then? Do you just wait for more tests and wait for other vaccines to develop? And in the meantime, are you just, isolating forever and masking forever?
Well, we're not at that situation just yet. So I think there's, and even if we got to the point where the variant was drastically new, often the vaccine can provide some cross protection. That's what we've seen with other vaccines like the flu. So, but even to the last question, actually, I didn't answer this part, that the manufacturers can develop new modifications to the vaccine. They can modify that messenger RNA to have it match the spike protein that's on the variant strains. And so that can certainly be part of the solution going into the future if this scenario comes up.
Right. And now that they've already developed sort of the base, modifying it, all of that process is much faster than actually developing it from scratch, right?
That's right. That's right. Exactly.
Right. Okay. And then this is another good question. We get this often. If you still have to follow the masking protocols and distancing and all of that, even after getting both your shots of the vaccine, what is the real purpose of getting the vaccine if it doesn't change how we have to behave? If we don't know how long it lasts, whether it just prevents symptoms or rather protects from spreading, what is the point, basically, what people are asking?
Okay, so the main point is that it will protect you from getting sick from COVID, from getting very sick from COVID, and may keep you from dying from COVID. So that's a really important thing. I think we're starting to learn more about the herd protection with the vaccines. If enough people are vaccinated, we can actually get to a place where we can actually modify our public health measures. So that is part of the long game, that eventually we will be able to change the way we live if enough people are vaccinated.
Right, absolutely. So I think this is something that again, because we get these questions all the time, I guess the concept is we have to continue doing everything we're doing in the short term, and then hopefully in the long term things will get better. That's the hope, right?
That's right. And right now you have to look like it's just a small percentage of people who have received the vaccine. And so we really can't make changes. And we have variants that are spreading, but we're not even at a point where even half of our population has been vaccinated. So we'll just have to keep gauging it. Yep.
Right, absolutely. And at this point, given what we know about the vaccine and how it protects you, it's not enough just for you to get vaccinated and then be like, okay, I'm going to take off my mask, I'm going to go run around, because it's not just about you, it's about everybody else as well.
Exactly. Yeah.
Right. Okay, let's go to a live question coming in right now. Anam Arshad asks, can COVID cause severe illness in children? Do we know that now?
We do know that children are less likely to get very sick from COVID. We do know that. I mean, looking at even in our city, thousands of children that have gotten sick. Those severe illnesses are very rare for children, but they can get that multi-system inflammatory condition that has been noted and can occur. And so that can affect multiple organ systems. A child can be quite sick, end up in the ICU. And so, yes, children can get very sick from COVID.
Right. Okay, let's go back to our submitted questions here. We're done with vaccine questions for now, but if you do have more questions, please continue submitting them. We're going to move on to the submitted questions. Sola asks, regarding the variants, is it possible that a less transmissible variant could occur instead of the ones that are more contagious, as similar to what they think is happening in India right now?
Yeah, so absolutely, a variant can develop that is less transmissible. I think the thinking is that if something is less transmissible, that variant might die out on its own. It might not become a predominant strain. But yes, absolutely, that can certainly happen.
Right. people are now. These are questions about when they can go out and do things. GOG asks, I have a June wedding with 80 guests that has been rebooked from 2020. Please advise if Toronto has now canceled such gatherings until July 1st.
So the City of Toronto has canceled the large gatherings. You'll see there was a news release that was put out about that. In terms of what is it going to look like for personal gatherings, indoor versus outdoor in June, I actually cannot predict that far. I wish I could. And so it's really a wait and see right now. I think you're going to have to be prepared for all kinds of different options, which I'm sure you've been thinking about, which is why you're asking that question. But June is still a long way away, and a lot can happen by June.
Right, absolutely. Okay, we've got a few mask questions, which we haven't had in a while. So let's get to those. Scott asks, how can mask mandates be justified if we don't have, if they have not been shown with any hard data to be effective?
Well, I think there is definitely emerging evidence to show that masks are effective. And I think you have, when we started the pandemic, there weren't a lot of studies on using masks, in your own home if someone had COVID, for example. Like those studies were hard to find. But now we actually also have population-based studies, studies even looking at schools in the U.S. where students who wore masks had better, less spread in schools compared to those schools that did not have that policy. So I think there is definitely more evidence emerging on the importance of masks. Now, part of masks being effective is they have to fit properly. We've talked about that. It can't just be, anything that's over your mouth. And certainly there is more evidence on the type of mask, which we didn't really have before. So, at least 2 cloth layers with the filter layer provides the better protection for a cloth mask, for example.
Right. Actually, we have a related question to that exactly. Are 2 masks better than a N95 or KN95?
Yeah, so the mask that's the best for you is the one that fits you the best, that you can breathe on, that you're not going to fiddle with, that air doesn't escape, that you can actually maintain. So that is really going to be the best mask for you. In terms of the double mask question, I mean, it depends. Like, what is your first mask like? If you have a very, very good cloth mask, at least 2 layers with a filter layer, that is good. Can you tolerate wearing that kind of mask with a medical mask or another cloth mask underneath? Those are all the other questions that you'll have to see what suits you.
Right. And then in terms of effectiveness, Amanda asks, how effective is just one mask? She says, Dr. Fauci says that 2 masks are 70% effective, 3 masks are 95% effective. So how effective is the one mask?
It's not so much about the one mask, it's about the layers in the mask. So I think a 3-layer mask, 2 layers with a filter provides the better protection compared to a single layer mask. Yeah. Right.
And then this is a question we've seen from the beginning of the pandemic. So let's address it one more time. Frank asks, does wearing a mask reduce the effectiveness of your immune system?
A mask does not lower or even strengthen your immune system, actually. What a mask does is it keeps your droplets to yourself, but it does not have an impact on the immune system.
Right. And then this is more of a sort of a behavioral question, but we'll ask it anyway. Citizen 271828. We had a question from them last week as well. They ask, a number of residents in my condo refuse to wear masks in common areas. Management hasn't been able to enforce it because these people say that they have an exemption. So what steps can I take to keep myself safer?
Right. So the most important thing is that you should wear your mask and keep a physical distance, and minimum of 6 feet distance away from these individuals. That will protect you. If you're on an elevator, maybe wait for the next elevator, for example. If you're in a stairwell, let them go ahead. Keeping that distance and wearing your mask will help you to stay protected.
Right. And then this is interesting. Zini asks, what is the percentage of COVID cases coming from retail in Ontario? Do we have that specific percentage?
I'm not aware of that. Now, the province of Ontario has some information on their website. So I'm not sure specifically what that number is. I think what we do know, though, is the more contacts you have with people, the more people you interact with in a day or a 2-week period, the more likely COVID does spread in a community.
Right, absolutely. Okay, Minu asks, can someone who has recovered from COVID still transmit the infection?
Well, yes, because what we say is that you're infectious for 10 days for most people for when your symptoms started. So if you have mild symptoms, you could be better after day 3, but you're still contagious for those full 10 days. We actually see this in children, actually, where they could have a headache for 2 days, the headache goes away, and they feel fine. But actually it was COVID and they're still contagious and they could go on to spread it. So yes, you can, even though you may have feel better, may have recovered, if you haven't passed those 10 days, you can still be contagious.
Right, okay. And that's why we talk about 10 days of quarantine or 14 days of quarantine or isolation, right? Because you don't know any time within that time you could be contagious.
That's right. And that's why we also say if you have symptoms, get tested. Because just because you have symptoms and you feel better, like I feel better, I can go back out, you could still be contagious. And that's why it's really important for all of us. If we have even one new symptom, we should go and get tested.
Right, absolutely. And then we have a couple of questions from Shailendra, again, a regular contributor to our Q&As. He says, good afternoon, Dr. Vinita. I have a few questions. Firstly, can central air conditioning spread COVID-19 in public places?
Right. There hasn't been any evidence for that so far. Now, I certainly think it's something that we need to keep an eye out. I mean, that's one of the things with variants. And if the virus changes and it changes the way it's spread, can it spread through things like air conditioning? There's no evidence for it right now, but it is something to keep an eye on. Now, originally we talked about there was, one study where, an air conditioner, kind of a window air conditioner blew air, and that actually then blew droplets and spread it to other people who were around. So in that way it can spread, but actually through a vent system, there's no evidence right now that it spread through vent systems.
Okay, and then the second question is, why are medical workers getting sick with or dying from coronavirus if they are wearing their protective gear?
Medical workers who get COVID don't always get it on the job. And I think that's a really important point, is that when they're at home, they may, depending upon their family situation, who they may have contact with, they could pick up COVID in those situations, and they're not wearing their full PPE in those situations. And so that can often be an important way that they get COVID beyond just the job. Yeah.
Great. Okay, and let's go to this one. It's a slightly alarmist question, but this one coming from Twitter, at only you2 asks, I have diabetes and I've had a stroke. If I get COVID, does that mean I automatically am going to die?
I don't think there's anything automatic about you dying, but I do think that you are at high risk if you do get COVID. And so I think in your situation, you want to do whatever you can to prevent COVID. Absolutely.
Okay. Okay. We just talked about this in terms of being outdoors and distancing, but we've got a couple of people asking this question. Toronto Bear and Tanya ask that when passing smokers outdoors or people that are walking outdoors or jogging, breathing heavily, that kind of thing, I'm very aware that I'm inhaling their exhaled smoke. What is a safe distance? 6 feet doesn't feel like it's safe enough.
Yeah, so I think, there is, when you're exerting yourself with physical activity, like in an indoor gym environment, previously we had the recommendation 3 meters apart, because that 6 feet distance may not be enough. Outdoors, the risks are lower, so the air is moving. That's in a gym where the air is maybe circulating less often, the risk is higher. Outdoors, the risk would be lower. And I would say keep a minimum of 6 feet. If you want to keep more than 6 feet, that will be even more protection for sure.
Right, absolutely. And then we have a few minutes left. Let's ask this one. According to the Ontario COVID-19 Science Advisory Table, the UK variant has been growing exponentially, even though we've been locked down and under stay-at-home orders, and it's estimated that it might be the dominant strain in Ontario soon. So are we facing a third wave, but with a lack of tools to control it? Because what else is left in our toolbox? We have lockdowns, we have stay-at-home orders, and we're still seeing spread.
Yeah, so I think what we've seen in the city is that lockdown and stay-at-home orders, while they sound the same, they've actually all been quite different. The gray lockdown that we were in was very different from when it was declared a provincial lockdown. And so I think there are still, while Toronto is still technically in a stay-at-home order, we're not in that provincial everyone stay-at-home order. So there are still some tools there that we can dial forward or dial back based on the situation. I think everyone needs to recognize that the variants are spreading, and so we all need to do our part to prevent those contacts with people that we don't live with, to stay at home as much as we can. And we're seeing that it's not just a Toronto, a GTA situation. I mean, Thunder Bay, Simcoe, Muskoka, that when the variants come, they can, as the viewer said, they can increase rapidly. And so I think now's the time that we all take our measures to heart. The other piece in our toolbox that we have is the vaccine, and it is coming. It's here. The more we can get vaccine into arms, that is going to be a big significant part in combating this as well.
Absolutely. And so we have 1 minute left, so I'll get to the last live question that we have here right now. Sona Khan asks, as you said about vaccines, are kids going to get the vaccine? And if so, what is the best option?
So right now, there really are no vaccines that are available for children. The Pfizer vaccine is licensed up to 16, but beyond that, there is no pediatric vaccine indication. And so we're going to have to wait for the vaccine to be licensed in kids, to be studied to show that it's safe, that it works in kids. And so right now, that's why the goal right now is to vaccinate adults.
Right, absolutely. And so that brings us to 1 p.m. Thank you so much, Doctor, again, for your time and answering all these questions. Thank you to everybody that participated with your live questions and submitted questions over the week. We will have more with the doctor again next week. So if you didn't have a chance to answer your questions, we'll get to them next week. Thank you again so much, Doctor.
Okay, bye-bye.
Bye-bye.